Good Day Solomons. One full radio program about engagement along Australia here on Solomon Islands, where he produced and presented by the Australian High Commission here along Honiara. Hello and welcome to Good Day Solomons radio program, a program that aims to inform Solomon Islanders about Australia's engagement in this wonderful nation of Solomon Islands. Good Day Solomons is produced and presented by the Australian High Commission here in Honiara. In this edition of Good Day Solomons radio program, we'll explore the Solomon Islands Medical Partnerships for Learning, Education and Research program known as SIMPLA. It's a program to support foreign-trained medical graduates to develop the necessary clinical skills and knowledge to safely practice and be licensed as doctors in the Solomon Islands. The program is managed by the Australian Volunteers International in collaboration with the Australian Government, Department of Foreign Affairs and Trade, the Australian Volunteers Program and the National Referral Hospital. We will hear from three participants in the program: Dr. Rooney Jagili, a general surgeon at the National Referral Hospital; Dr. Freddy Famalasu, working as a registrar at the Emergency Department at the National Referral Hospital; and also Frances Kennedy, a former volunteer from Australia who is now working in the National Referral Hospital as an infection, prevention and control advisor. More on the experience with SIMPLA program in this edition. With you, I am Zeri Lenny. You stop listening to the Good Day Solomons radio program, where he produced and presented by the Australian High Commission. Now listeners, some of you may be wondering what the SIMPLA program is. It was designed and implemented in 2019 at the request of the Ministry of Health and Medical Services to support foreign-trained medical graduates to develop the necessary clinical skills and knowledge to safely practice and be licensed as doctors in the Solomon Islands. Through SIMPLA, Australia has provided Australian medical professionals to Solomon Islands who work side by side local colleagues, helping supervise and train large numbers of foreign-trained medical graduates. The program has supported the development and registration of medical officers prior to postings to area health centers across the provinces. Over 65 trained doctors had successfully graduated from the program before the COVID-19 pandemic disrupted the program. COVID-19 pandemic impacted on service delivery, mobilization and program implementation. SIMPLA volunteers were repatriated and intern supervisors were no longer able to travel but supported the National Referral Hospital where they could remotely. Now, as things head back to a COVID normal world, the program is kicking off in full force again. Dr. Jagili, a general surgeon at the National Referral Hospital, saw the importance of maintaining the program. Let's hear from him.
SIMPLA program is a program that came out of our partnership with Australian Volunteer International. So the program helps us primarily in the training of graduate interns, especially the graduates who come back from outside of the region, from Cuba, China, and also Taiwan. So the program is such that SIMPLA help us to coordinate the program, and also they provide outside volunteers who come from Australia to help to mentor, train the new graduates. And this has been a tremendous help to us because we do not have the local capacity in terms of numbers to run the program on ourselves. So when the volunteers come, they really lighten our work. And the volunteers help us when they come, not only to train but also to provide specialized care to patients. There are treatment pathways, treatment guidelines, even researches that have been done together with the teams that come. So the program has helped our young interns to gain confidence over time, and the partnership has basically improved the level of care that we produce here at the hospital. Well, we have very good relation with the volunteers that come to help us. They are very passionate, they are very dedicated, and also they're very knowledgeable and very experienced in what they do. So we basically get along together. We have a lot of respect for each other. We read the same textbooks. There are people that are known both to us. So we have a very fruitful and very cordial relationship with the Australian volunteers that come to work with us. We will continue to need the support of the Australian volunteers to come and help us until such time that we're able to run the program on ourselves. But I think it's also pleasing to say that the program has moved on from just training the interns to now helping us to run a postgraduate diploma in rural medicine as a pathway for many of these doctors in supporting the health service, especially in the rural and remote areas of Solomon Islands. And I think this goes perfectly in line with the Ministry of Health's role delineation policy, in which improved health service is provided at lower levels of care throughout the country.
You stop listening to Kamlagude Solomon's radio program, where he produced and presented by the Australian High Commission. Dr. Famalasu is a registered doctor with the National Referral Hospital and has worked with the Australian doctors through the Simpler program. Let's hear from him about his experience as an intern in the Simpler program.
My name is Dr. Freddy Famalasu. I'm 34 years old. I am from Malaita and I work here at the National Referral Hospital at the emergency department as a registrar. I did medicine in Cuba, in a province called Matanzas.
What motivated you to study medicine?
I just wanted to help people, I guess. Yeah, help people. And becoming a doctor was a really good way of helping people. And growing up, I remember going to the clinics and it would be really full, and then I'd have to wait in line to see a nurse or a doctor. But this was back in the 90s. Even then the clinics were really full. So yeah, I guess that motivated me to want to help people. And I graduated in 2016 and then I came back to the Solomons. And in 2017 I had to do the bridging program here at the National Referral Hospital. It was a year-long program and I did rotations in internal medicine, pediatrics, obstetrics and gynecology, and general surgery. So because I studied medicine in Spanish, I had to relearn most, if not all, of the stuff in English. And I also learned the basics, putting in IV cannulas in internal medicine, diagnosing the most common infectious diseases here in the Solomons. In pediatrics, I learned about identifying the very sick babies, children, and what to do. In obstetrics and gynecology, most common emergencies, delivering babies, and I assisted in cesarean sections. So this was during the bridging program. The AVIs who were working at the hospital back then were very, very helpful. Dr. Rami was here. He was a pediatric registrar, so he helped a lot. He made sure that we had classes every afternoon. If someone didn't show up if one of the other doctors didn't show up, he made sure we learned something that afternoon. Yeah, so we learned a lot from him, from Dr. Rami. I learned a lot from him, and also from Dr. Rebecca in obstetrics and gynecology. She gave us classes on doing deliveries and things like that.
What were the benefits that you saw from that medical education program?
The bridging program really helped me a lot. Helped me learn the medical procedures I had to learn, and gave me confidence to do the procedures when I had to do them.
What was it like working with Australian volunteers?
It was really, really good. I learned a lot. I really enjoyed working with them. They were very approachable. Like any question I had, I could ask them and I would get an answer. They would almost give me the answer, tell me what I wanted to know, and if they didn't know, they'd tell me, I'll read up on it and I'll tell you tomorrow, or I'll tell you later. So they were very approachable. They helped a lot, and very friendly, very knowledgeable. They really knew their stuff. Yeah.
Where do you think you'd be, or how do you think that process would have been without the bridging program and the internship?
It would have been really difficult for me to practice medicine here, to transition from knowing stuff in Spanish and having to do medicine here in English. Yeah, so I think it would have been really difficult. And I think some of my friends who graduated later, I don't think they had that many AVIs helping them. And yeah, I think better off looking back. I think the bridging program really helped me. And
You stop listening to Good Day Solomon's radio program, where he produced and presented by the Australian High Commission. We've heard from two Solomon Islanders about their experiences with the simpler program. So let's hear from Francis Kennedy, a former Australian volunteer. Francis worked with AVI for 4 years. Since 2018, she has worked in the emergency department of National Referral Hospital, working with nurses as well as the medical workforce training program. Let's see a little bit about her work.
That role was as the ED Emergency Department Nurse Advisor, so supporting the ED nurses in their learning and training and education. And then I moved over to the Medical Workforce Support Program, so helping the bridging interns or the returned medical graduates with their training and their education.
So looking at those medical graduates, how have you supported them through the internship program? What does it look like from sort of start to finish?
Okay, so unfortunately all the other volunteers had to leave in March 2020 due to the advent of COVID. So the volunteers that were running that program were gone, and the program was having difficulties because the local doctors were so busy that they couldn't dedicate much time to it. So I was moved across. Very fortunate to have a fantastic chair in Dr. Jagili, who's the head of surgery here, and he managed to help me, and we led the program along with remote support from the other volunteers, and we managed to get it up and running, got the volunteers through. They had lots of training, lots of workshops, and in the last 2 years we've had 100% pass their program. So,
how many actually did pass?
So the first year we had 10 that passed, and the second year it was 12.
Looking back on your time as an Australian volunteer, what would you say some of the highlights were of supporting that program?
Okay, a major highlight for me was definitely seeing them pass. When they arrived, they were scared, inexperienced, not very confident. And then when they finished, they all stood there in their little white coats and said their Hippocratic oath, and it was just really moving.
What have you learnt through the program?
I've learnt a little bit about Solomon time. I've learnt to slow down. People joke about Solomon time, but there's a lot to be said for it in the right circumstances, and I think I've learnt to take my time in developing relationships and let people come to me with their problems or their queries, and let the situation evolve rather than just rushing in like we Australians tend to do.
And listeners, that wraps up this edition of Good Day Solomon's radio program. Join me next fortnight for more on Australia's engagement in Solomon Islands. On the broader Australia-Solomon Islands partnership, you can find more information on www.solomonislands.embassy.gov.au or call us on 21561. Further inquiries can also be emailed to simediaunit@dfad.gov.au. You can also visit our Facebook page, Australia High Commission Solomon Islands. Until then, from me, Zeri Lenny, bye for now. Good Day Solomons. One full radio program about engagement along Australia here on Solomon Islands, where he produced and presented by the Australian High Commission here along Honiara.